We're live.
Great. Hi, I'm Malik, licensed acupuncturist, herbalist, and nutritionist based in the UK. I'm interviewing a fantastic colleague and friend from the US. He has the busiest and the most, I would say, the best result-driven clinic in Texas. His name is no other than Jimmy Yen. Welcome, Jimmy.
Malik, thank you for having me. It's great to see you. Last time we saw each other was in Australia, so great to see you again. Thank you for having me, and I appreciate you allowing me to share my experience with acupuncturists in the UK and also all around the world.
Great. Jimmy, you're one of those rare individuals that really sort of, I'd say, I'm lucky enough to come across. And I guess I'd like you to be kept a secret. Okay, but this, and I know you specialize in, a number of areas really. And I know neurology is one of those areas that I think was one of the videos many years ago I came across that you've done, and that's what kind of led me into yourself really. And yeah, I mean, amazing. So how did you get into neurology?
Yeah, so great question. So I kind of, fell into it. It wasn't like I had, like some people, they do have a calling, from very early on. And for me, it wasn't that experience. My experience was, I started off as a general practitioner, acupuncturist, and I treat, all variety type of disorders. And then, I started getting phenomenal results with neurological disorders, more specifically like neuropathy, migraines, I was just getting a lot of patients from that and was getting great results. And I had this one patient that had pretty severe neuropathy. He had problems walking. He needed to wear braces on his ankles to help him walk. And I was able to help him. He had a lot of nerve pain along with numbness. And so I was able to help him, be able to get back walking, and which was huge for him in driving, because one of the things that people with neuropathy, severe neuropathy, is they can't drive because they can't feel the gas pedal. So they can't feel the brake. They can only go. They can't stop. Right. And so he was driving. He lived in Austin, but he was working in San Antonio, which is about an hour to an hour and a half away. So he was driving that 1 hour each way every single day. And so being able to drive was crucial for him. And he was losing his feeling in his feet. And so it was hard for him he was getting scared that, he may not be able to continue to drive. And so, we treated him for a couple of months, and needless to say, he was able to drive. He was able to keep his job, and he actually was part of a neuropathy group, a support group. And so he asked me to go speak for this group and just share my experience with the results, with him. And so I went there, and then I spoke to the people, and then, a lot of the patients, wanted to give it a try. And so they came to my clinic, and pretty much 90% of them got improvement. And so it was rare that we weren't able to help, someone from that group. And so then, I was very blessed with all the great results that we got. This neuropathy group is a nonprofit organization, Neuropathy Alliance of Texas is what it's called. And they had a medical advisory committee, and the medical advisory committee, was to help them make decisions on what they recommend for their association in regards to neuropathy, the treatments of neuropathy, and education about neuropathy. And so they already had 4 other Austin, Texas's top neurologists on the group, and they asked me to join their medical advisory committee. So I was very touched and honored, and so therefore I joined that group, and that kind of propelled me even more into the neurology specialty. And so since then, that was, I don't remember, that was probably 6 years ago or something, I'm not sure, a long time ago. And since then, I've just been treating a lot more neurological cases, and I've developed a specific protocol that is actually very effective for regardless of whatever neurological condition patients have. This set protocol actually produces great results for everybody.
Great, excellent. So, I mean, it's a wide area.
Yeah.
What conditions do you treat?
Yeah, so neurology has so many conditions. I don't treat every single one of them because I haven't had the experience of treating some disorders. But I would say the most common ones that we treat are neuropathy, which is nerve damage, and nerve damage that usually occurs in your feet, in your hands, but it can occur anywhere in your body. So neuropathy is one of them. Another one is migraines, like I talked about. Many people have migraines. Migraines is a neurological condition. We also treat Bell's palsy, which is facial paralysis. One side of the face gets paralyzed. We also treat tremors, more specifically essential tremors. There's different types of tremors. People, when I say tremors, they think of Parkinson's, right? And I've treated a few Parkinson's cases, but I haven't treated it enough to say that, hey, we're really good at treating it. But from the tremor side, we've treated essential tremors, which we are really good at treating. Then we have dystonia, just involuntary muscle movements. The most common one we treat is cervical dystonia, which is of the neck. So basically they'll have like this involuntary contractions in their head that they can't control, like little tics almost. And I've treated a person who has vocal dystonia, where their voice, will, their voice, let me see if I can mimic, their voice sounds kind of like this, is like it's just tremoring, and it's not really clear. So tremors is another one that we've treated. Trigeminal neuralgia is also one that we are very good at treating. It's basically pain within the trigeminal nerve. The trigeminal nerve is just 3 branched nerves that goes into your face. One goes to the forehead, one goes around under the eye, the cheek, and one to your mouth. This is one of those pains. I think they call it like this. It's the suicidal pain because it's so painful. People want to commit suicide because it feels like someone stabbing a knife in their face. And so it's super painful. Trigeminal neuralgia. What else? I know I'm missing some things. Those are the ones I can think off the top of my head. So we just started treating multiple sclerosis. So I want to, that's one of my cases that it's actually pretty exciting. But I haven't treated a lot of those, but we have treated a few. And yeah, I'm just trying to think. Yeah, I would say those are the ones that jump into my brain because we're treating patients with these disorders right now. Yeah, so I would say, those are some common ones.
Great, excellent. Well, that's a lot.
Yeah.
That's a lot. And I'm sure you get pretty good results with all of them. Which are your favorite out of those? I know you get good results generally, but which is exceptionally, I guess your favorite are the ones you get really high.
Yeah, great question. I just thought about another specialty, sleep disorders. So sleep disorders like insomnia, that's also a neurological condition. And so we also treat insomnia very good. So to answer your question, what is my favorite? And the favorite obviously is the ones we get even better results than the rest. Neuropathy. Neuropathy is number one. Yeah. Neuropathy, without a doubt, we get phenomenal results. Doesn't matter what caused the neuropathy. Some of it we can reverse 100%. Some of it we cannot. But what I like to say is it's not about reversing neuropathy, so to speak. It's more about getting our patients' quality of life back, because neuropathy eradicates their quality of life, and just the ability to get them back to doing what they were doing, what they love to do, what they want to do. That's what we consider as success. Sometimes that may be we're able to, like, for example, getting on the golf course. We have this current patient. He loves to play golf and cannot swing, cannot get on the golf course, cannot swing. He can barely walk. And just last week, I believe last week, he was able to get his golf clubs out and start swinging the golf clubs, and he felt great. But he still has a numbness. He still has neuropathy. We consider that a success because he's able to get back to doing what he loves to do. In his situation, he came to us too late. He just didn't. It took years. Neuropathy is, the sooner you get to us, the sooner we can reverse it, and the sooner you get to us, the higher percentage we can reverse that neuropathy. So I'll say neuropathy is definitely one of my favorites, and one of the best success rates that we have. Second, I would say is migraines. I would say pain. Migraines in the trigeminal neuralgia. Those, we give, patients will walk into our clinic and we give them instant results. Like we can literally instant reduce the migraines and the trigeminal neuralgia. Now, it doesn't mean that it will instantly go away forever. It will still come back because, again, people don't come to us until 5-10 years later, and they've tried everything and nothing works, and then they come to us. So their body's not in a condition where I can be able to eliminate in one treatment, right? But to reduce the pain, like a majority of the time, if they come in with a migraine, we can reduce pretty much almost every migraine that comes into our office. Same with the trigeminal neuralgia. So that, I would say that's another favorite. The newest favorite, it's not because we have tons of success with, but it's just because it's so interesting, is the multiple sclerosis case. We just haven't gotten enough. So, maybe people who are watching this video who have MS and thought that they could never regain their quality of life back, give us a call and let us, see if we can help you. Because this patient, that I'm thinking about, he's actually an anesthesiologist. So he's a physician himself, and he was losing function. And so that's why it's so exciting. But to stay on your topic, so multiple sclerosis is one. And I always say, and I talk about insomnia, I would say the tremors. I like the disorders where we see instant results. We see instant relief.
Yeah.
In tremors, we see it. It's like we'll have a patient with tremors, and we'll have them hold something, because essential tremors is the one that we treat. Majority is they're using stuff, so they're like eating, right? So eating. Well, if I use mimic a fork, right? So if I'm mimicking eating, so the essential tremors, they're like this. They can't use their fork. They can't eat. If they eat, they'll flick the food out, right? And so it's hard, and it's even hard to just reach their mouth because they're tremoring so bad. It's just like sometimes they'll just put it on their chin, put it on their cheek. They miss their mouth. And so being able to see that instantly, like when we insert the needles, instantly their tremors go from this to just barely tremoring, and they can at least go to their mouth and feed themselves, right? I mean, things you and I do on a daily basis that we take for granted. I mean, we take for granted the ability that we can breathe. We take for, like simple things, right? Simple things like being able to eat, being able to literally put food in your mouth. Why? We disregard these things that are so simple. But when someone with tremors, these things are not easy. It's a struggle to eat. And so to be able to see them instantly, be able to, almost like doing the eating function, I mean, that's just, I will never get tired of seeing that every single time. So I'll say those are probably my favorites.
Brilliant. Yeah, that's amazing. I mean, I had just the other week, a chap that had the trigeminal neuralgia, and he was explaining that he's just a friend I met.
Yeah.
And I said to him, try acupuncture.
Yeah.
And his reply was just brushing it aside, basically. And I thought, well,
yeah,
what's it to lose?
He's
as though I was selling something. He felt, or I wasn't selling anything. I said, not necessarily with me, but just try it,
Yeah.
So it does get, and I don't understand some people, but anyway.
He's probably not hurting enough. That's probably what.
Yeah, it's great. I mean, I guess what I could answer this question, but from what you said already, but I'd like you to tell me again. But why do people in Austin, Texas, choose your? Because you've got an area that's saturated,
Yep.
400 plus clinics,
Yep.
and why did they choose you over the others?
Yeah. So there's a lot of things that we do. Obviously, results is number one. And so it was results. It was because of results that I was, uh, invited to be on a medical advisory committee. It's because of results that the Austin, Texas, the top neurologists all refer patients to me. Um, because I've had neurologists that I've never even met, and they heard from another patient of theirs, that they were coming to me, and the patient was going back for a checkup with this neurologist, and I'm thinking about. I can't say his name because he's actually in a hospital group. He's in a hospital group that doesn't encourage them to refer outside of their hospital group, but he does because their hospital group has their own acupuncturist, but he's referred patients to them before and not gotten the results. And so he still refers patients to me because we get results. So that's the bottom line is, our patients get results. They get the results that they want. That's most important. We focus on what the patient wants, not what we want. If it was what we want, we're focused on elimination of symptoms of the numbness, and patients, all they care about is their quality of life. They just want to be able to live their life, enjoy their life. And so when we focus on that, then patients are happy, right? And so, results is number one, definitely. I can't speak for other acupuncture clinics. I can just say for myself, in my clinic, in my team of acupuncturists, we get great results that physicians feel comfortable referring to us, and we're honest, we're transparent with our patients. We're not going to drag them along. There was we had a new patient. We had a new patient recently that came in, and she just moved from another city, from Dallas to Austin, and she, I forgot what was she coming in for. She was coming in for some type of pain, I remember. And she had acupuncture before. She had acupuncture for 6 to 9 months in this other city, Dallas, Texas, and didn't get results. And so, so the number one thing she came to us, and when she came to me and I was doing her initial exam, she was like, pretty much the only reason I'm in your office is because a good friend of mine, told me that your clinic was different. Your acupuncture clinic was different, because she had given up on acupuncture because she had gone to this other clinic 6 to 9 months. She wasted a lot of money and she didn't get any relief, didn't get any results. And so she was very skeptical. And but her friend told her about her experience in my clinics, and so she came in and gave us a try. And needless to say, she came in with some type of pain, and the first treatment, I instantly reduced it. And so, but that's the second thing I would say. So first thing is results. The second thing that people choose us is because the experience. I like to say we provide the Four Seasons Hotel. I think UK has Four Seasons Hotel, right?
Yeah.
Yeah. The Four Seasons Hotel is known for their 5-star experience. So
I've never stayed there though.
was that?
I've never stayed there.
Oh, okay. Well, they are internationally known for their 5-star experience.
Yeah.
And so that's what I, train my team on providing for our patients is a 5-star experience. I mean, getting results is one thing, but it's even better if you can help the patient, experience the acupuncture, the treatments in a 5-star style. And so that's what we're known for in Austin is our 5-star experience. And many patients actually almost every new patient that's come to our office this week, it was from another friend who experienced our 5-star experience and told their friend that they need to come to this clinic because we provide that experience. And number three, I would say transparency. We are 100% transparent with our patients. I know, patients are scared of, being dragged along. It's like, having to come to so many treatments and then not working, and or having to do tons of, like this patient in Dallas, having to do 6 months of treatments before you found out, oh, it doesn't work. So in our clinic, we know very early. We know within a week if acupuncture is going to work for you. And that's just because of our own technique that I created. And we know very early on if acupuncture, within, I would say 1 to 2 weeks, we will know if acupuncture works for you or not. It is very black or white. So we are that transparent. We are very black or white. Acupuncture either works or it doesn't. There's no gray area for us. And we communicate that, to our patients and let them know exactly what to expect. What can they expect from us? What results can they expect? And what goals are we trying to achieve? We are very good at communicating the expectations and so the patient knows exactly what is going on. In, when they're getting treatments at our clinic, they know exactly what is going on. There's never a time when when they're like, oh, what am I doing here? They're confused. And so now, if they have questions, we answer all of them. We love questions. We have a concierge email, just like the Four Seasons Hotel. They have a concierge. We have a concierge email. And if they, email me over the weekend, it doesn't matter. I will answer them. So it's like 24/7 service. That's what you get when you come to achieve integrative health.
Brilliant. Brilliant. Yeah, excellent. And as well as acupuncture, you do herbs as well, don't you?
Correct. Yeah, we do a lot of stuff. Acupuncture is just what we're known for, but we do Chinese herbal medicine. We customize the herbal prescriptions for our patients. We do dietary. We help people with their diet. We help people with nutrition, supplementation. We also have other services that, some people don't come for acupuncture. Like we have an infrared sauna. We utilize infrared sauna technology, which is great for neuropathy patients and neurological conditions. Is very good. And we have a whole body vibration therapy, which is pretty interesting because I found that therapy actually when I went to a horse rehab center. And the horse rehab center was not to rehab horses. It was using horses to rehab humans. And so people with disabilities. And so they were using it's called equine therapy. And I saw that they had a plate on the floor. It was this big, long black plate on the ground. And I was asking, so what is this used for? And they would say, oh, when the horses have infections, they put the horse onto this vibration plate and it helps eliminate the infection so that they don't need to use antibiotics. And so I was like, okay, if it works for animals, why can't it work for humans? And so therefore I found a company that makes it for humans, and we have vibration therapy for humans.
Okay. Do they lie down or do they have to stand?
They stand. They stand or sit. So it's very good for our neuropathy patients, especially the ones that can't walk. And so it helps them exercise because it basically vibrates all of their muscle fibers, small fibers, large fibers, and it basically mimics almost like exercising. And it basically, if they can't stand, we just put a chair on it and they sit on it.
Yeah. Okay. Yeah. That's. If you could share some details of that later on, please. I'd like to look more in detail with that myself. Great. Brilliant. So, almost the last question. What's the process for someone that comes to your clinic to find out if you'll be able to help them or not?
Yeah, so that's a great question. So, like I said a little earlier on, the process, is you got to come in. Everybody comes in for the step one is initial exam. I need to examine you to know if it's worth even trying acupuncture. Okay, so once I examine you and see, okay, I'm looking for things that may inhibit acupuncture from working. If there is something, and sometimes most of the time it's some type of structural thing. structural damage. For example, you have stenosis in your spine, you have a physical herniation that's pressing on, a disc herniation that's pressing on the nerve, you have a tumor that's pressing on your nerve. Those are structural things. Those things acupuncture is not going to fix. And so we need to rule those out, because if we don't rule those out, I can do all the acupuncture I want and you're not going to get better, right? Again, this is about the transparency. This is about making sure that we rule out everything and make sure that acupuncture is actually a good option for you right now. And when I do, in most cases, I will say acupuncture is, because we're usually, like you, we're probably the last resort. And so patients usually have already gone through millions of physicians. So they've had all the imaging, MRI, CTs, they've had the nerve conduction test, they've had blood work. So they've got all of it. So we usually, patients come in with that information. So we can rule out, okay, you know, what structural problems they have and what do they don't have. And if it's, what can acupuncture actually do? Because if you have a structural, let's say you have a bone pressing on a nerve, like we treat neuropathy from back surgery. We've had a couple patients, they had back surgery. They didn't have neuropathy before, but after their back surgery, that induced neuropathy. And whether the surgeon nicked the nerve or there's still some structural problem pushing on the nerve, you know, we're not going to remove that structural problem off the nerve. And that lets me know, hey, we're not going to be able to eliminate your neuropathy 100%. However, we will still be able to maybe get you 50% and if you're 50% better, you're going to be able to walk better. And so, you know, again, those are that tells us, knowing that, doing that exam lets us know to what extent can we help the patient. So once we know that we can help the patient, then we go through a trial phase, or a test phase, I would say, a test phase of treatments. That's usually between 3 to 6 acupuncture treatments. And within these 3 to 6 acupuncture treatments, we will know definitively if acupuncture can help you or not. Within these 3 to 6 treatments, I expect improvement. Okay. Now, that's one of the advantages of our clinic, because of our unique acupuncture technique, which I call the QRA, quick relief acupuncture. We see symptom improvement pretty quick. Like pain, it's instant. But with neuropathy, it takes a little time. But still, within 3 to 6 treatments, we expect to see some improvement. If there is no improvement at all, then the acupuncture is not going to work, and we stop right there. And then we refer them out to see what other options that they may have. But if they do see improvement, then we continue, because then I know for sure we'll be able to help them. And then we go from there. And then it's different for every patient, because everybody responds differently. And so that's the reason why we do those test treatments first, to see specifically how you as a patient would respond.
Excellent. Thank you. So just to wrap up, if someone wants to contact you or get your details, how do they contact you?
Yeah, so they can reach us. You know, we're pretty much everywhere. They can call us at our phone number is 512-260-1710, and I'll write it under this post. And also achieveintegrativehealth.com, achieveintegrative, TIVE, health.com. And they can find us on Facebook, LinkedIn, Twitter, Instagram. We're all over the net. And if you can't find us, I apologize. You know, we need to solve that problem for you.
Brilliant. Thank you very much, Jimmy. It's wonderful. Thank you for your you're a very busy person. Thank you for your time, and sharing your knowledge and sharing what you can do and to help people. So thank you very much, Jimmy.
You're very welcome, Malik. And it was great seeing you again and great talking to you. And yeah, let's keep spreading the word of acupuncture in the UK. Let's blow it up in UK.
Yeah, brilliant. Lovely.
Bye, Malik.
Thank you very much.
Bye.
Thank you.